Hi, good morning, everybody. I'm so happy we can see each other again. This is Andrew Lau, Lowsutea president. Well, it's great that we have a chance. We can share with you some critical information regarding, you might say, wow, how can, if I'm a pre-diabetic or diabetic, how can it get me some stomach issue? Actually, it is quite common. A lot of people who has diabetes, and sometimes it will just have stomach issues, which is terrible, and it can be a real, truly emergency. You know? And so you really have to know some of the key facts regarding the possibility, what kind of sign and symptom for you when you have stomach issue, and how they relate it, and how did it cause. And because of the fact that many people don't realize, even like, for example, when you are really become a diabetic, it actually diabetic damage your nerve. And that nerves and actually affected lots of the stomach issue because it has, you just don't feel you don't feel the problem until it really suddenly comes up to you. So today is a big area topics that you can actually wrap everything together to understand what kind of problem of so-called gastrointestinal, which is your bowel issue when you have diabetic, and what happened when that's happened. What should you do? Do you go to a doctor or do you go to hospital? Today, we're going to spend all this time to better discuss that. So let's start a webinar. I think today is a very, very good webinar. Can help you better understand some of the risks and things that you got to watch. And so that's why I thought that this seminar will be very good for everybody. So let's start. Now, so today our topic is gastrointestinal emergency in diabetic. And what do you know? What do you need to know? And what do you have to know to make sure you know you're going to hospital or doctor's office? So today's topic will first introduce and what is the overview of diabetic and GI health, and also what the common GI mean, the gastrointestinal emergency in diabetic will have usually, and what's risk factor is because of the diabetic, which will require emergency, and also recognize what is a warning sign, so you know once that comes, oh wow, I need to go to hospital or doctors, and how you prevent and manage this GI issue, or so-called the gastrointestinal issue, and how Lowsutea can help you. And we have question answer and so forth. This is the agenda today. Now, today's webinar is actually very, very good because a lot of people don't realize gastrointestinal issue. I have some customer actually called me and said, I have this issue. Why is that? And I said, wow, you are really truly a big diabetic or serious diabetic. Some of the signs that you have to watch. And so some of the clients, because we talk to us and then we have to understand a little better, so they become more preventive, and so they don't get serious problem. I will explain that later why. Now, I noticed today that a lot of people are not familiarized, people probably from the United States, Canada, and also from Southeast Asian country and Hong Kong. So what I will do is catch up with everybody how you become a diabetes. Now, all people will most likely go through this 4 stage of becoming a diabetic. The first stage is LDL cholesterol goes up. It damages the B cells come up from the pancreas. B cells will take sugar to the cells. It damages, so more and more B cell come out. It doesn't work, and blood sugar continue build up in your bloodstream, and the LDL cholesterol, blood sugar add together, and it will start forming plaques everywhere because the blood become very thick, form plaque, and they will very quickly move to stage 2. Now, stage 2 is because of all these plaque forming, and the blood vessel become less and less space, so blood pressure goes up. And this kind of plaques actually do not reverse. It will stay there forever, ever. So as you go on later, your diabetic become more serious. This plaque will continue to plug up your brain, your heart, your kidney. That's why diabetic is a total body disease. And you only can able to control not to get worse, but you can get well. And that is the key. And that's why, a lot of people realize diabetic, this is the major issue, forming plaques everywhere in the whole body. Now, very quickly, your blood sugar will continue to build up. You have no sign symptom. You don't do anything much. You will move to stage 3, which is called a pre-diabetic stage. In pre-diabetic stage, all doctors measure the same thing. It's called HbA1c because everybody has hemoglobin, and they measure amount of blood sugar attached, percent of blood sugar attached to the hemoglobin blood cells. And if you're 5.7, you're a normal person. If you are 5.7 to 6.4, you are pre-diabetic. Unfortunately, in pre-diabetic, you're not diabetic yet, so you don't have medication. The doctor will tell you, hey, you know what, you're pre-diabetic, you have to change your lifestyle, you have to have low-carb diet, you have to exercise, you have to cut down weight. Now, lots of people hear that, but don't know what to do. And they basically are staying the same old lifestyle. Now, one thing you can help you is drink Lowsutea because it definitely helps you to lower your blood sugar, cholesterol, and improve blood pressure. So I'll tell you a little while later why you need to drink and how Lowsutea works. But you don't do anything, you don't drink Lowsutea, most likely 2 to 3 years will convert to diabetes to stage 4. That's means your A1C is over 6.4 and continue to go up. Now, the doctor usually say, hey, you are pre-diabetic now, you got to get medication. So 6.4, either 6.4 to 7, A1C of 7%, they will start you on medication. Now, once you start that, you know what? You are now a certified diabetic. So you're going to have a hard time getting insurance. Your blood sugar will continue to go up. And the doctor will tell you, oh, well, you're diabetic now. You have all kinds of problems coming in. So you have all kinds of issues that you really have to work on to bring it back down to below 6.4. So that's why I really encourage you, don't get yourself to from pre-diabetic, diabetic. Help yourself change your lifestyle so you can be always not become a diabetic and you don't have all the diabetic complications. And the people who are diabetes right now, no problem. If you do your lifestyle change and drink Lowsutea, you can bring yourself back down to the pre-diabetic stage 6.4. We have lots and lots of our patients do that. They don't need insulin anymore. They don't need medication anymore. And you know what? They are like in A1C below 6. That is wonderful. And that's your objective. That's what you're going to do. So you might say, hey, why you keep saying drink Lowsutea? Now, Lowsutea have only 2 things in there. There's guava leaves, which is help you to delay the sugar entering the bloodstream. So less sugar into the blood cell, the blood vessels. So less sugar in there is better for you. Secondly, it has bitter melon, which increase the insulin sensitivity. So take back the sugar to the cells. But the wonderful thing they have is bitter melon able to dump out all the excess sugar, the blood LDL cholesterol, and salt out the urine. So net result, it doesn't reabsorb the body. So with that, you are lower your 3 high, which is your blood sugar, your blood LDL cholesterol, and blood pressure. Isn't that wonderful? If you can able to maintain normal level of 3 high, most likely all the diabetic issue, complication, heart, brains, kidney problem will not there because we'll be lower all those risks. Okay. Now we don't just say, oh, okay, keep drinking those sugar. We have a program to help you to continue to keep you healthy by 1, teach you how to do low carb diet, low fat diet. We teach you how to do exercise. We'll help you to do weight control with BMI 30. We can help you to lower it to 23. But you have to do it though, right? You also listen to free webinar like what we did today. Every week we'll give you 1 webinar. And then you learn about all the diabetes disease, what to eat, how to prevent your diet become too high a carbohydrate. You ask you to do exercise, how to do exercise, how to do weight control. So net result, you always become healthy and low. Even people have low, high A1C, more than 10%, they drop it down lower than 5.7. And teach how to track your bloodstream, and that's what we'll do. Okay, now let's talk about how do you connect this GI problem, gut problem, due to your diabetic. This is a big topic, but it's a very important topic If you understand it, wow, you know that's important. Now, your gut is so important. You always have to have healthy gut, which is help you to manage your weight and also diabetic control. If you are, for example, you don't control your gut, your big tummy, your most likely your insulin will not be effective, and net result, your blood sugar will continue behind. Now, in the gut, there's a lot of microorganisms. It's called microbiome, and so is microbiome. This there are trillions of bacteria in there, but this is residing in the gut. You have to have it, because you don't have it, you're gonna have diarrhea and you have run. Really, this gut is healthy. Gut is help you to keep yourself healthy. What it does is help you to break down food, absorb the nutrient, and regulate all the energy, and also help you to maintain healthy weight and control your blood sugar level. Now, if you don't have that, the poor gut health will link to like obesity, and diabetic issues. So your bacteria, healthy bacteria in the gut is also a non-heard of, is normal form. It's important. This is really good. So let's talk a little bit. What is the role of bacteria in the metabolism and immune function? How can it help you on your gut? Okay. Now, first of all, if you have an imbalanced gut of microbiome, and really especially for pre-diabetic, diabetic patient, you can have all kinds of issues that come by, because the gut microbiome is help you to break down all the food to absorb nutrition, and also it produces short chain fatty acids to process, and that is really important. Now, if you don't have that, then you have possibly have inflammation, because there's if you're imbalance of gut microbiome, that lead to all kind of chronic inflammation. In other words, the gut become inflamed, and you have your insulin sensitivity become lower, so you affect your blood sugar regulation, because if your insulin doesn't work, your blood sugar will continue to go out. And also, some gut bacteria also alter, and basically it won't process your carbohydrate and fats, and that also lead to high blood sugar level eventually. And also the good health bacteria actually help you prevent harmful bacteria to take over. So eventually it actually help you to in sense of strong immune response. So you won't have any issues. It just help you to improve immune response, so keep it more healthy. Now, however, you also have issue of leaking gut, which one of the line of the gut, which is the intestine, is somewhat have leaks, and then the bacteria, the byproduct, which leak out into the bloodstream. Now that is bad, because that causes inflammation and also cause insulin resistance. So these why the natural good bacteria are good for you. So you got to understand you have to continue to improve this bacteria. Now, however, if you are diabetes, you tend to have a lot of so-called potential GI issue in diabetic. The first one is gastroparesis, which is mean the stomach takes a long time to empty the food content to your large gut. Net result, you might feel nauseated, vomited, and bloated, and you will feel full very easy. After eat a little bit, you feel full. Now, these kind of conditions, you actually need doctor help. Now, also another one is you got esophagus symptom, which is mean that after you just eat a little bit, you start getting heartburn, and basically this is like the gastric juice kind of coming back out to your your chest, like coming up burning. So you have hard time swallowing, trouble swallowing, or both, and so you feel heartburn. Now, another one that can be common is pancreatitis, meaning your pancreas is inflamed. And so it causes pain on the upper belly area. You feel nausea, vomiting, and sometimes you fever. So you really have to, with that, you got to actually go to see doctor to get it treated. And also you have candidias, meaning fungal infection, can occur in diabetes. So there are all kind of common issue of diabetic that come around. So you need to look at that. This is just an open eye for you. Now, other GI issue will be intestinal enteropathy. In other words, lead to like diarrhea, constipation, problem control of bowel movement. These are common in diabetes, especially constipation. A lot of diabetes people have constipation issues. I'll tell you, I have several lectures where I talk about how do you help the constipation. And also, you may have fecal incontinence. In other words, your stool, you can lose control of the stool, your bowel movement. It happens, you have leaks. And that is always have that issue. A lot of people, oh, I feel, like something came out. It's very embarrassing. A lot of people is concerned. And on top of that, it's also a common problem is stomach acid moving up to esophagus, often experienced like with diabetes, heartburn, and all that. And on top of that, there's an issue a lot of people don't recognize is non-alcohol fatty liver disease, which is common issue is the liver with fatty liver acid, but they don't drink alcohol, but they have fatty liver. So this is another thing that is common for people. Now, also another one is diabetic ketoacidosis with abdominal pain. Now, this is serious. If you have diabetic ketoacidosis, you got to go to the hospital. And what is the condition is when you are not really managing your diabetes, you basically continue ignore, and now you can't get the insulin, get the sugar into the cells. So the body is start taking the muscles, burning that up. So you basically become the blood become acidotic. And on top of that, it triggers infection, when you miss insulin dose or high stress, that can be an issue, lead to that too. So also the sign and symptom with that is you're going to have severe stomach pain, you feel nausea, you're vomiting, or you are tenderness, the abdomen to touch, and plus your blood sugar is high, usually over 200 something, or in Hong Kong will be like 18, 20, 21, something like that. So you really have all kind of issues coming along. And another one is gastrointestinal hemorrhage, meaning the diabetes lead to digestive system to start bleeding. So you're going to start forming ulcer, swollen blood vessels, and also the symptom usually you start vomiting some blood. Your black tartar stool from the stool become black, okay? And also could be fresh blood coming up the stool. And you will have, or some people will also have low blood level, anemia. You can have potentially get shock. And so when you are DKA, which is diabetic ketoacidosis, you can't fool around. You go hospital. Remember, when you have diabetic ketoacidosis, you go hospital, not go to the doctor office. Go to hospital because the time is the key that really get you to be very, very sick usually. And emergency is somewhere you gotta go. Now, also some other issue is you have other sudden stomach issue crisis, and this sudden worsen is basically a stomach due to slow stomach emptying, so low stomach, slow, meaning the food is not emptying to the stomach to the gut, and due to high blood sugar or due to some medication. Now with that, because the food are not going to the intestine, so you're getting ongoing vomiting, you will continue to vomit, you will dehydrated, and you feel, wow, real bloated, and that's not good. And really, at that time, you will usually have low electrolyte because you're not able, the food are not going down to the gut. You just stay in the stomach, and you might be malnutrition, also potential you get food that got into the esophagus and dropped to the lung. So in that result, we had lung infection due to inhalation of the food liquid into the lung, due to you regurgitate the food instead of throwing out, you got into the lung. A lot of elderly folks tend to have that problem, so you gotta really watch. As the elderly have this kind of problem, vomiting and dehydration, blood pressure going down, the electrolyte, because they're low electrolytes, so usually go very, very tired, can be even confused. All these things come along. These persons require immediate medical attention. You go to hospital, not doctor. Now, also, you have non-alcoholic fatty liver disease, which is basically you're not alcohol, but you have now fatty liver disease, and which is a major risk, leads to many different liver problems. And usually the problem is your stomach pain, and then your skin and your eye getting yellow, jaundice, and you start getting confused, and you have abdominal swell. Now, this need to go hospital. So something that we've been talking about, all these hospital attention, not necessarily a doctor, because you're now getting jaundice. You gotta really get to hospital to fix this real quick. Now, also the acute pancreatitis, which is really your pancreas become inflamed. So for a diabetic patient, so with that, you usually have severe stomach pain, radiation to the back, you're nauseated, you're vomited, and you're fever. And if you continue to let it pancreatitis going, you might actually end up to be shocked, and then you eventually become multi-organ failure, which you don't want to be about. Again, with acute pancreatitis, you go hospital. So we are now talking about a lot of this stuff. You need to go hospital, because I want to let you know, if you have this kind of sign symptom, this is not hospital doctor case. It's really more hospital case than because acute. Now, also you might have porphyritic, the vessels. You might have ulcer, which is like an ulcer, and because you have the bowel is not leaking, and then you have serious leaks of blood supply to the bowel. Now, this is also real issue, because you're gonna have now you're leaking bowels, basically. You're severe stomach pain, tightness, sign of abdominal infection, and you can't let ulcer or blood or item from the bowel leak out, which will cause you tremendous issue, because you're going to have a lot of peritonitis, serious infection, multi-organ failure. So if that has happened, again, you got to go to hospital. Now, also another thing is you might have bowel obstruction. Wow, that's even worse, because the nerve damage from diabetic affected the intestinal movement is supposed to go like that, right? So because you now have bowel obstruction, you have severe constipation, which a lot of diabetes person has constipation. But if you can't come out like 5 days, you have a big issue. So your stomach become really bloated, you have pain, you have nausea, you vomited, and then you cannot pass gas anymore, no stool also. The more important is every day you gotta have passing gas. Now, if you don't pass gas, you might want to start looking at, maybe you need Metamucil, you might need to drink more water, not water, maybe Lowsutea, because really Lowsutea can help you lubricate. So you important drink more Lowsutea, so you're hydrated, because you need this water to help you to get the stool making and going out. So you might need something like Metamucil or more fiber item to help you move the bowel. So passing gas is important, meaning you have to pass gas before you can get stool. So if you don't get stool 2-3 days, you don't pass gas, and the 4th day you don't pass the gas, you have no stool, and you start getting tremendous bloating, you feel uncomfortable, you gotta really quickly either go hospital or doctors to help you. Now, the risk of, if you continue, don't do anything, then you have a risk of the bowel start tearing apart, and the lack of blood supply, and you can have a big issue coming along when you don't treat. So a lot of people don't see that when they have diabetes. They never realize this is how serious can be if you have diabetic. All these are quite common GI issue where in diabetic when they're not managing diabetes. And that is something that you have to really look at. Now, another thing is acute diabetic diarrhea, which is when you have a lot of nerve damage and the bacteria inside, this is the bad bacteria now, start overgrown. Not your normal bacteria, the bad bacteria start growing a lot. So now you're going to have watery diarrhea, you're going to have dehydration, and then you have the body salt imbalance. So in other words, your electrolyte is not going to get worse. And that result, you go weak. And then on top of that, you're going to start getting maybe even your vital sign will changing. So you got to really stop the diarrhea. You might be dehydrated because, your electrolyte imbalance. And on top of that, if you continue not being treated, you might have potential kidney damage. And then if you continue dehydration, you severe dehydration, you actually go into shock. So again, that with the acute diabetic diarrhea, you actually go to hospital to check to ensure that ensure that you are not going to so dehydrate and lack of electrolyte become shock. Now, another one is diabetic can also lead to poor blood flow to intestines. Now that is bad because when your intestine had not actually getting enough blood, so you have sudden intestine abdominal pain, and then especially when you have after physical exam, finding you get nausea, vomiting, bloody and stool, and so really at the end of the day, when you have sudden abdominal pain and it gets worse and worse and worse, and now you go to the doctor and you find that you continue nausea, vomiting, and bloody stool, that you have to be treated. And the bowel issue, it will continue to get worse. The infection might be due to more infection, or could be leaking bowel. You have to be treated as soon as possible. If not, you actually end up will be dying potentially. So these are a very acute issue that you really have to, go to see medical attention rather just, wow, I was wait a little while to see doctor. That's not good. So the few items that earlier we discussed with you, these are very serious issue which you need to actually quickly go medical attention. And that's why I prepare this lecture, because a lot of diabetes don't know. They will never think of, wow, you mean I can affect my bowel? Are you kidding? So a lot of people just thought blood sugar going up. It's just blood sugar in the body. But it affects your bowel tremendously because, nerve damage, all the other issues come along. So it affects also your normal bacteria forum, the normal bacteria. And so all that issue will create lots of issue for you. That's why I think it's complicated. You need to really work on and make sure understand you have that issue. You go to hospital, not doctors. Now, you might say, well, what is the risk factors, of all these coming along? Why I will have my gastrointestinal emergency? What risk will bring me that? Okay, the first one, you got to stop smoking. Smoking can cause you that. Secondly, I will actually have very obese, overweight, my BMI over 30 and more plus. As you go bigger BMI, more problem you're going to have. You have to also, you have a lifestyle, you don't move at all, you don't do exercise, you only watch TV all day long. Plus, you have very poor diet. In fact, you don't do the typical suggestion of 150 grams of carb per day. You eat tremendously all kind of things with high carbs like bubble teas, Coca-Cola, all these poor thing with poor diet, that is a very common thing. Plus, you are very stressed, continuously stressed. Plus, you drink a lot of alcohol, beer, whiskey, all the things you drink. Plus, you have certain medication you take. Plus, you do have a family of diabetes. Plus, you also have chronic vomiting. You keep vomiting. Now, all these things can really give you the high risk of potentially of gastrointestinal emergency, the GI issue, so-called the GI emergency issue. So keep that in mind. Few warning signs you have to remember. If you have severe stomach pain, and then your intestine continue, so painful. Now, this might be a sign of serious coming. Could be inflammation of pancreas, could be a blockage of intestine, could be a reduced blood flow to intestine. Now, this pain is painful. You don't want to move. You're lying on bed, you're groaning, and you don't. And one more thing, a lot of people don't realize that a lot of times they don't have bowel sound already because they're obstructed. So you don't feel like you're passing gas, feel like the stomach has no movement. These are the time that you need to go to the hospital because you need to figure out what blockage you have, why the gut doesn't move anymore. Plus, you might have sudden nausea and vomiting. You start throwing up. And then you feel very nauseous and start throwing up a lot. And you don't know why, okay? And it get worse and worse. And the worst thing is you get ketoacidosis, meaning the blood become more acidic, or a blockage of intestines. Now, really, all these has to be treated immediately to the hospital. Matter of fact, lots of doctors would say, okay, you can't have food, we'll stuck an IV on you, get you hydrated, get your blood sugar down. All that is not in the doctor office. All that go for a hospital. So that's why I make sure that you understand all these warning signs. If you have severe stomach pain, suddenly, so painful, I can't move, I stay out of bed, I don't feel like moving at all. And you feel sick, and you feel, you want to throw up, and all these things, and you feel so bloated, and your stomach just don't feel like moving. These are the signs that you are actually admitted to the hospital and is not going to doctor office. Plus, because of that, you're not eating anymore, so you got to start a sign of dehydration. You feel thirsty, dry mouth. Now, because you might be potential blockage, so you really don't want to drink a lot more water in there. Maybe just wet your tongue, your lip, and you're on your way to the hospital. And with that, though, your urine become very dark orange. Dark orange. It's not typical yellowish color anymore. And you feel tired, you feel dizzy, and you feel dehydration, and also you have been thrown up or diarrhea. That's very common. So all that you need to also look at part of adding a symptom together with the pain, stay in bed, don't kind of move, no bowel sound, all that will come along. And usually also your blood sugar level, you notice that your blood sugar might be kind of spike or maybe even drop. It depends what situation. Now, also usually if you're infected, inflamming, your gut are inflaming, so you will also affect if you have also other condition. Your stomach also don't empty the food to the gastrointestinal. So all that add together will make your blood sugar will be looking real weird. And plus, your vitals will start changing tremendously. You might drop your vitals. Your blood pressure start dropping. Or some people have other issue. Your blood sugar can be issue. Your blood pressure can be issue. Pain tremendously issue. All that has to go emergency. You have the emergency doctor attend. Now, all the symptom will not go away without treatment. It will continually get worse and worse and worse. That's why you have to go to the emergency room to get doctor to help you out. You have to monitor the blood sugar, keep track, make sure the blood sugar are not getting so high sometime or drop down so low. Usually, you also need to be hydrated. That's why they will stuck IV on you. So make sure you don't get over dehydrated because of the loss of fluid. And so the doctor in emergency will help you on that. And you also, when you start having this issue, a lot of people forget is they write down when they start. For example, oh, I started maybe 12 o'clock in the afternoon. I did stomach pain already. So you know you have a duration of 8 hours before you get the emergency. So you write down the time when you start getting this symptom, really severe pain. You start vomiting, how many times you vomit, how many times you throw up and felt very sick. Write it down. If you have a blood sugar monitor, you monitor blood sugar, what's the number, and you have to write down the vitals, meaning your pressure, blood pressure, your heart rate, all that will be. Now, a lot of times, matter of fact, if you're an elderly person, you also got to write down his O2 saturation. So see all that. So when you go to a hospital, you have this document to show the doctor. The doctor says, wow, okay, I know you are now already 10 hours without bowel movement. And that is the issue. So he will make sure that have that information so he can treat you as soon as possible. So this documentation is very helpful to understand the diagnosis of your case, okay? So all that talk about now, you have all that problem we talk about, and it can be scary. So my next question is, wow, how I can change all that so, I don't have all these emergency issues occur to my bowel movement or my gut or whatever, and the GI issue, okay, it's gastrointestinal issue. So really, at the end of the day, you have to change your lifestyle, and the lifestyle will give you very positive impact to your health. What's that mean? You have to reduce stress through activities like meditation, deep breathing, and then you have to eat well to support the healthy gut microbiome, meaning building more natural bacteria to your gut. And that's important, meaning you have a lot of vegetables, a lot of fruits, and you have to avoid smoking. Really, excess smoking, alcohol will cause you that problem of the gut. If you stop smoking alcohol, your gut health will be really work well. And you have to work with healthcare professional to develop a personalized plan to improve the health, all the stuff you do. For example, the diet, exercise, your weight control, especially for pre-diabetic diabetes. Changing that lifestyle will definitely improve your blood sugar, your cholesterol, and your blood pressure. Now, one of the things that a lot of people don't kind of ignore or forgot, hey, drink Lowsutea daily, 6 to 8 cups will manage your blood sugar, better manage your blood cholesterol, LDL cholesterol, and your blood pressure, and also potentially lose some weight and help you the digestive overall system. And the tea is also have a good detoxification function. So all that will lower your 3 high and detox. So that's something that you gotta continue to pursue. Now, probiotic is important because you gotta sometimes you eat a lot of antibiotic, for example, your natural good bacteria might be shot. So you gotta give more probiotic, providing the good bacteria for the gut to continue to help you to do digestion, to help you to improve your gut health. Now, probiotic actually a lot of time now is you can buy the probiotic formulas in supermarket will help you grow these better bacteria, so you can build up good bacteria to improve the insulin sensitivity, blood sugar control, potential benefit also, especially pre-diabetic and diabetes. Getting probiotic is very good. Yogurt can a lot of times, the special yogurt also have the probiotic effect. With that, they also decrease the inflammation of the gut, so you create less chances of various chronic disease. important, really decreased inflammation is a good thing for the entire body. And with that, because you're high probiotic, you actually enhance the digestion and more better nutrition absorption. And because of that, more probiotic and more good bacteria is actually help you build more stronger immunity. So really important is you got to have more natural bacteria to help you to get better GI health, better nutrition, digestion, improve your insulin sensitivity, all that come from there. Now, certainly you might want to say, I want to work with a healthcare professional, develop a personalized plan to achieve this health goal. That is absolutely good. And also, you need a plan to include dietary recommendations like low-carb diet, more fibers, exercise, lower your weight. All that is important. And a healthcare professional definitely can track your process, adjust all the needs you have, but you need to have a specific program to actually get this established so you establish timeline for achieving this goal. And that is important. And Lowsutea definitely will help you because it helps you to improve your blood sugar level, improve your LDL cholesterol level, and blood pressure. And basically in there's two things. Guava leaves just delay the sugar going to the gut. Bitter melon improve the sensitivity of insulin. So take sugar in the cells, and excess sugar, LDL cholesterol, and salt will dump out urine. So when salt went down, your blood pressure will go down. Plus, it will help you detox. So it solves your three problems of three high. Decrease, lower your high blood pressure, lower blood sugar, lower your bad cholesterol. Three high: sugar, cholesterol, and blood pressure. Now, once you achieve that, the chance of you become healthy is extremely good. The risk of getting diabetic complication much more decreased. So you will now, what we'll talk about today is diabetic can impact your auto nervous system, affect your GI mobility, because as I said, it actually affects your whole gut because you're diabetic. If you have prolonged a long time of continued high blood sugar, you can lead to many of the different conditions, like for example, your gut, your stomach starts slowing down, pushing food down to your gut. You might have diarrhea, you might have constipation. And that often a GI issue are not overlooked by a lot of individuals. A lot of diabetics don't realize, wow, diabetes, it can relate it to my gut, my GI. Okay, a lot of people don't think that is this. And because of that, it can be significant affect your quality of life because you get diarrhea, you vomit, you feel bloated. It's not good stuff. So what you want to do is early detect, understand what is the issue, the sign symptom. Like for example, suddenly I feel bloated, I feel my stomach feel very painful. And so you now know the sign and symptom, will go to hospital, not go to the doctor. And the prevention of this is make sure you continue monitor regular blood sugar monitoring, follow good diet. Like for example, carb is only 150 gram carb for diabetes, and then eat a lot of fiber, small meal, and then stay hydrated. That's the reason why we actually plan Lowsutea with 2 liters water every day, 2 liters Lowsutea every day. The reason is make sure your body hydrated, have enough fluid, and dump the sugar out to throughout the body. Let more sugar get out and the cholesterol get out and the blood pressure, the salt get out so your blood pressure can be improved. And basically that's what we do, Lowsutea. So that is something that you always remember. Now, I hope today's lecture helped you to kind of give you an idea what is Lowsutea all about, and what is the really overall how diabetic impact your gut and that is important. And how Lowsutea can help you. And if you have any question, do write to me, Andy, A-N-D-Y, at WAHFONG.com. Andy, A-N-D-Y, at WAHFONG.com. Or WhatsApp us, 1-800-388-0903. Or write to another WhatsApp is 852-6792-8891. 852-6792-8891. So do write to us, and we're looking forward to talk to you, and we can able to find out the kind of issue you have, and we can hope that we give you some answer. Okay, today's lectures is pretty much give you everything, and I hope that you have a better understanding now. If you're diabetic, you need to look at your GI health, your gastrointestinal, gut health. You gotta look at that and build your normal flora, which is normal bacteria. More of that is better for you to digestion, improve your insulin resistance, and get you healthier. Okay, I thank you very much for all the time you spent with us. I appreciate that. I appreciate and good to see you again, Rita. Hopefully that you can continue to make sure to improve your health through good exercise, good diet control, low carb, less fat, do exercise, 10,000 steps a day, lower your weight, and drink Lowsutea 6 cups to 8 cups a day. And that will definitely help you to lower your tree high and keep you healthy. All right. Thank you again. Have a wonderful weekend. Take care. Bye-bye.